All right, I think we can go ahead and get started. We don't want to waste too much of your time here tonight. So thank you all again for joining us for our panel tonight. I'm very excited about the conversation we're going to be having with these amazing panelists. So this is talking about our new normal, air quotes implied, COVID-19's continuing impact on women and children of color. About a year ago, we gathered many of these same faces. We were 1 year into the pandemic, and we were talking about how the public health crisis is impacting all of the communities that we serve. So flash forward a year, and we are kind of in many ways still in many of those situations. So I'll go ahead and introduce our panelists tonight. I'm Christina Pei. I am Housing App's Vice President of Philanthropy and Communications. And tonight joining us, we have Debbie Fox. Hi, Debbie. Debbie is the Deputy Director of Housing Policy and Practice, and she has worked in the domestic violence and sexual violence movement for over 20 years. She's currently working at the National Network to End Domestic Violence, and she's worked with a focus on fundraising, organizational development, nonprofit administration, and domestic violence with population-specific housing and economic justice programming. We're glad to have you here today, Debbie. Next, we have Liz Reinhardt. Liz is the Executive Director for Suited for Change, the DC area's leading nonprofit for women in need of professional attire, mentoring, and job readiness education. Previously, Liz was a leader at both DC Central Kitchen and Food for Others, the largest provider of free food for families in Northern Virginia. Thanks for joining us tonight, Liz. Next, we have Michelle. Michelle is joining us from DC Safe, where she is a Director of Crisis Shelter Services. Michelle joined DC Safe in 2014, overseeing the Safe Space Crisis Shelter. Michelle also oversees the housing and community outreach programming. And finally, we have Sonia Gahimbare. Sonia is Housing App's Permanent Supportive Housing Clinical Manager. She currently works with more than 300 households. She's been with Housing App for 3 years as a licensed independent clinical social worker who provides clinical guidance and program management to our permanent supportive housing program. Thanks for joining us tonight, Sonia. So we will go ahead and kind of dive right into this conversation. Like I said, it seems like a lot of things are kind of resetting. The Omicron variant has retreated, and a lot of people are saying that we're returning back to normal. But of course, we know that COVID-19 is still here. It's still infecting people, particularly, since young children can't get vaccinated, and there's still a lot of vaccine hesitancy in some of the communities that we do serve. And then on the employment front, I know, Liz, you're going to talk about this later, but, January's job support showed great gains, adding almost 500,000 jobs, but that growth was largely driven by men. 1 million men joined the labor market in January compared to only 39,000 women. So, question for everyone. What trends have you been seeing in your communities since we last talked? And would you say that we are indeed, returning to normal?
I would say, I think the desire to return to normal is high, but I really see that lots of things are still stagnated. People are still not working. Folks are still trying to figure out what to do next. And so there are some challenges around returning to that normal and people sort of being motivated to sort of move past the crisis. I think what we're seeing at DC Safe is, and saw during these last 24 months now, that the violence is increasing. Gun violence, we saw 3 of our clients murdered in the last quarter through gun violence. We're seeing domestic violence being up in general. We went from receiving 6,000 calls last year to 11,000 by the time that process was over. When we finally got clients to come in for safety, we were seeing more injuries, increased types of injuries, broken bones, broken jaws, black eyes, lots of strangulation, and again, more gun violence. We're also seeing non-IPV cases where just the IFOs, right? Families, multiple generation families are in homes together with short on supplies and money and patience. We're also seeing family members just fighting more in between that and getting more family disturbance calls into the hotline. And I would also see that we're seeing community violence. We don't normally manage that, but we're seeing a lot of calls in from families and the police telling us about community violence in the community. So for the most part, violence is up in the last 24 months. Mental health is deteriorating. A lot of the services, and they are coming back online, but that first year really had an impact on folks who were maybe not medication compliant, or lost contact with their community workers, or couldn't get into their therapist, or just generally was overwhelmed by the sort of doom and gloom of everything. And so we've seen a lot of our clients come in and really needing extra support outside of DV around their mental health. And I would say this, just in general, we're seeing a lot of people coming to DC. Lots of people coming from the South saying that there are not services there, they can't get into shelters, they can't get their housing. And so they're coming to DC sort of as this mecca, like my cousin came and she got housing, or my cousin came and she got her benefits, or my mom came and fill in the blank. And so we're seeing a tremendous uptick, and I'm sure that's across the board for all programming in DC, seeing folks coming from other states to get those services they feel like they're not getting in their jurisdiction. So that's what DC Safe is seeing right now.
Wow, that is a lot. I'm going to turn to Debbie, at in an EDV, kind of looking at DV and intimate partner violence on the national level. What have you all been doing and seeing, and what trends have been popping up? I mean, I'm sure a lot of what Michelle is saying is resonating in cities that are not DC.
Yeah, thank you, Christina. And I'm really glad to be here with you all. Yeah, what you were speaking to, Michelle, definitely is resonating on the national level. And I think a lot of what we're experiencing is around some of the increased increased need for services and the stressors on families and interpersonal violence. Like, it's just there's a collective trauma, and thinking about the historical trauma in our country and how that plays into what we're currently going through, and the lack of a social safety net is really the hardest hit on the families and those that are most vulnerable, communities of color, LGBT communities, and as you mentioned, Christina, women for sure that aren't having access to be able to work. I mean, it would be amazing just thinking about, like, if we had childcare or some sort of safety net for women to be able to go back to the workforce. And speaking, I live in DC, in particular, most of my friends who have kiddos are paying a mortgage for childcare. So that is definitely out of reach and inaccessible for single folks and working moms. So, I keep thinking back to there's still a real need, but a lack of federal buy-in and bipartisanship around an agreement on a social safety net. So I think about that a lot in terms of, like, how or where would we need to be, or when will that happen, where we have a social safety net for those that are most vulnerable. And I think we had a glimmer of it during the pandemic when there was stimulus checks and a little bit more where people were able to have that time and that rest. But it's really hard and really difficult for those of us who have jobs and sometimes can work virtually to manage family stuff and our lives, and if we have folks who are having illness or disease or COVID in our families, it's very disruptive. And so imagine if you're having a lack of income or a lack of housing. So yeah, it kind of ties back to a lot of the safety net pieces. And I do hear from our programs and providers quite regularly, even though there has been increased investments in housing, whether it's homelessness housing or there's now rental assistance housing that was passed 25 billion. I'm still hearing a lot of stories and anecdotally from folks that they're not getting access to those resources. There's emergency housing voucher money for those experiencing homelessness and for survivors, and hearing from a number of folks that either survivors aren't getting access to those vouchers, or even if they do get access to those emergency housing vouchers, which would give them stable long-term housing, the housing markets are just so out of reach as well. And we have seen a real boom, sadly, during COVID, and a lot of real estate speculation in the real estate markets, and an increase in, there's tons of, we could Google it, tons of articles, and the doubling of rent in a lot of communities, and particularly in the South, and in communities of color where there's investors and LLCs that are buying entire buildings and impacting communities, and evictions around communities of color. So we have, we have a lot of work to do, I think, in this country in terms of a social safety net, and some of restrictions is the right word, but like just safety and priority for affordable housing. And if people are in housing, how do we keep them in that housing so they don't lose it? So I don't want to be totally a downer, but it's a very difficult time, and this is what we're hearing from people, but it's really hard to get access to housing. And my hope is that we have a safety net for those who are most vulnerable in our country, but I think that's still hard in many communities, and some folks in some places are doing that and making those priorities, but we still have a ways to go.
Yeah, absolutely. I will say, can you talk a little bit? I did see some potential good news, a glimmer of good news in terms of protecting families and women. Are there any updates around the Violence Against Women Act?
Yeah, so we did pass the Violence Against Women Act, which is actually really, really wonderful news. That happened last week. It was part of the fiscal year 22 omnibus bill. So the House passed it a while ago, then the Senate passed it as part of their budget for fiscal year 22. And so we're really happy about that. They didn't have to have a Senate hearing, and there are some expansions in the VAWA reauthorization that we're really happy about and looking forward to having implementation. So it's strengthening the Violence Against Women Act, and we want to serve more survivors. And in terms of specifically, there's additional resources and programmatic investments for culturally specific programs. And now there is economic justice provisions, and there's also increased access for survivors of all genders. There'll be a program for LGBTQ services at the Office of Violence Against Women, which is desperately needed. And then the law also restores tribal jurisdiction, so tribes can hold non-native perpetrators accountable. And then there's also increased housing protections and increased access to emergency and short-term housing. So there are additional life-saving protections, and we have been trying to pass it for 6 years. The last time it was passed was 2013. So some people are more tired than others.
Yes.
I'm not the tiredest, but there's some people who've been working on it a lot longer. My boss in particular has been working on it for a long time. So yeah, people are very happy to have that. It was signed today by the president. Yeah, so we do have good news in that realm. And then there is additional housing unrelated to VAWA in the budget for next year. There are additional housing resources that are included in the fiscal year 22 budget. So we're excited about that. And I can put a little link in the chat box of some of the highlights, the VAWA highlights. And some of the housing protections do include ensuring that survivors can call and get access to safety if they choose to do so, and not be penalized for nuisance ordinances. That's been an issue for a lot of communities, where if you called the police, you would sometimes be at risk of eviction because your landlord would say you're a nuisance. So things like that have been added to the bill. So yeah, so there is some good news. It's always a good reminder. Thank you, Christina. I'll put a link in the chat box.
Thank you. That's really helpful. I was very glad to hear that was passed today. So a little small clap for something that should have been taken care of a long time ago. Liz, I want to turn over to you. We've talked a lot already. It's come up. I think Debbie, Michelle, and I have all mentioned employment, the many, many hurdles that women face to re-enter the workplace. What's going on over at Suited for Change?
Well, I'll tell you, listening to Michelle and Debbie, it really explains what we're seeing, because the women that we serve are still in crisis. Like Michelle said, we're hoping that we're coming out of this, but the families that we serve are still in crisis, and they've experienced so much trauma over the last 24 months that almost going back to work is one of the farthest things from their minds right now. And I you've explained it, Michelle. I'm sitting, when you were talking, I was like, that's exactly what we're seeing. What I said previously is, it was easy for me to say, back in January, I was thinking, well, at one point there were more children home quarantined than there were children in school. And the women that we serve cannot go back to school because they don't have childcare. Debbie mentioned that childcare is so expensive. And the women that we serve, they don't have the resources to pay that. And they're single moms, they don't have other people to fall back on. So that's a crisis right there. We all know that women end up shouldering the burden of children being home, even when there are other family members. We also talked about the fact that the women that we serve traditionally work in the hospitality sector or the restaurants as concierge, jobs where you can't work from home. Debbie mentioned that they can't work from home. So there's no way for them to go back to work. And I was feeling like we were making progress and it was getting busier. I mentioned to some of the panelists earlier, and then I actually looked back on our numbers from the first quarter, and they're almost the same as our numbers from last quarter. And so while we are seeing this opening, the women that we serve aren't ready to think about going back to work right now. They just don't have what they need in place to be able to go get a job. So it's sad. I'm almost embarrassed. I'm starting to feel like we're obsolete. We've been racking our minds trying to figure out how we can serve. I'm glad that Christina was trying to mention what are the positive things happening, because I was starting to feel a little overwhelmed too. I will say that when I looked at my suiting numbers, women who came to us for professional clothing and coaching, I got disappointed. But I will say that we're already approaching the number of workshops that we did last year. We did about 9 workshops. This year we've done 6 so far in not even 3 quarters. So what that tells me is our referral partners, the other organizations like you that are out there, we've done a workshop at the House of Ruth, so others might eat, Catholic Charities, DC Central Kitchen. So it's telling me that the places that are training women are back up and running, which they weren't for a while. And that means that women are getting themselves into programs. And so when they are ready and they have everything else in place, then we'll be here to serve them. But that's what we're seeing as well. And thanks, Michelle and Debbie, for explaining to me what's happening out there. Ugh.
I mean, it's like you said, how can you focus on work when your child is unvaccinated, you're still in crisis? Mental health is still such a concern too. Actually, speaking of, Sonia, now's a good time to turn it over to you. You obviously are dealing with the families who have been dealing with all of the things that we've been talking about today: mental health issues, employment challenges, DV challenges, family kind of conflict challenges like Michelle was talking about. So how have Housing Up families been faring in the past year since we last talked to you?
Yeah, I mean, I think it's much of the same as the other panelists were mentioning. When it comes to domestic violence, there is a lot more, like we're the ones that pretty much, we call Michelle, Michelle's team often when it comes to emergency housing. And what we're seeing is a lot of non-traditional situations with interfamily violence, intergenerational families under one roof, violence in communities and how that impacts the families that we work with. And I think what I've been seeing is a lot of families who aren't as worried about finding housing as they are about finding housing in safe communities, because a lot of the violence is concentrated in specific parts of the district. And so even when we're talking about the ability to relocate our families, a lot of them just don't want to live in those areas. And there's a lot of different things that property managers will do to try and avoid actually receiving voucher holders into their properties, whereas maybe they will increase the rent amount to just above the rent reasonable rates for that unit, things like that. And also what's rent reasonable in terms of DC Housing Authority and their vouchers hasn't really increased over the past few years. So as we have like rising rental rates, the amounts that the vouchers will pay isn't in step with that. So that's another barrier that that I don't know gets talked about as much, but and when it comes to employment and kind of going back into the workforce, like the other panelists were speaking to, a lot of families are just trying to catch up from all the things that have happened in the past year. So trying to get re-engaged with their mental health providers again. And the flight of people in those professions has also impacted that ability. So we still have clients that are still waiting to get connected with their mental health provider because they had so many people that have left the mental health support team. So they honestly are trying to figure out how to staff up to support these clients. And even when they get that mental health support, when it comes to childcare, the other thing that we saw a lot of are a lot of children being born during the pandemic. So even they're able to get some of the kids into school, they end up having maybe, you know, the infants still in their care that they're trying to support. Another barrier when it comes to employment and the childcare voucher system we have is a lot of the childcare vouchers are attached to families' TANF, temporary assistance for needy families. And there's certain requirements they have of them, including engagement with their job vendors. And through that, they'll get referrals for a childcare voucher. But what happened during the pandemic is that a lot of families got out of compliance with their job vendors because they were dealing with, you know, managing their families, managing their kids. And so rightly so, in their minds, they're thinking, well, why do I need to engage with my job vendor when, you know, the kids are at home and they're not in school? So we're really working with families to get back into engagement with their job vendors so that they have access to childcare vouchers so that they are available to engage in workforce development. But also, like Liz was speaking to, we also want to make sure that we allow them the time, the opportunity to breathe a little bit in that in-between time. And that, you know, now that your kids are in school, now that you have some of these mental health supports, you know, let's debrief a little bit, you know, so that it's not kind of moving from one thing to the other, and making sure that the families we're working with feel like they have the opportunity to rest a little bit. Because for a lot of them, you know, the past year was just really, it was really traumatic for them. It was traumatic for all of us, but I think they were dealing with some unique situations. And so we really want to make sure that we're supporting their mental and emotional sort of health in step with helping them look towards the future.
Yeah, absolutely. That space, that time is so important. And unfortunately, a lot of the communities we serve don't have that privilege of space and time. I think we talked briefly about this, but the eviction moratorium ending, obviously, you know, it's impacted the families that Housing Up serves. I know a lot of case managers and our staff are working very hard to connect families with emergency rental assistance and various federal and local government sources of funding to prevent eviction, which is one of the most kind of destabilizing things that could happen to a family already in crisis. So Debbie, you know, as eviction moratoriums are lifting or have been lifted across the country, you know, what are you kind of anticipating when it comes to housing insecurity and people already at risk for all this kind of in the home violence that we've been talking about?
Yeah, I mean, definitely the stressors, and there's like you mentioned, there's a lot of research around evictions, what a trauma that is, and how that can have really long lasting effects. And there's a lot of information and research on that, how that impacts children and families too, and long-term developmental outcomes. What I don't know is what's going to happen specifically, but I do know that the program has been very effective in terms of keeping folks stabilized and housed. There has been a talk about kind of like an eviction wave that will start happening. And I don't know if it'll be that huge in terms of like if it might be more incremental, but there are a lot of concerns around increased evictions and hearing of like, you know, whole entire properties being evicted, or sales of properties, or that communities there's less mom and pop landlords as a result of the pandemic, and people have sold some of their housing to homeowners. And so there's I think there's real big shifts in the market. And I think it still kind of remains to be seen, like what the fallout. I mean, my worry is more families experiencing homelessness, more. We obviously see in major cities, there's more folks on the street homelessness, singles homelessness, and just a real increased pressure in cities to try to address street homelessness. So I do worry that that we're, with the limited resources that we have at the federal level, and then there's not always investments at state or local levels, that there's always this tension around serving people who are street homelessness, like what people consider like quality of life issues, and a lot of pressure to house street homeless folks first, which I just wish there was enough resources for everybody, that there wasn't like families not having to compete with people who are already experiencing homelessness, or someone attempting to flee domestic violence. But there was a lot of work in the Build Back Better agenda for affordable housing investments and additional resources to address long-term housing solutions. Unfortunately, the social spending part of that bill didn't stay afloat, and we're kind of left trying to still push for it, but people aren't really talking about it at the federal level. But there definitely needs to be a real conversation around, how do we keep people housed? Because the expenses and the human cost and the trauma around experiencing eviction is really very, very horrible. But it's in terms of a prevention and a cost effectiveness approach, it's much more affordable and less social spending and less harmful to families and communities of color if we keep people in their homes and housed. So I really wish we had more federal investments, and I really wish the Build Back Better social spending part of that agenda had passed, but it didn't. So we're still here trying to have the conversations with representatives and legislators to have those discussions.
Right.
So that's that's a policy moment. So a little, not like a less programmatic, but it still remains to be seen. But I think it's going to be really hard on poor and low-income families. Like, we'll get to bear the burden of this time.
Yeah, unfortunately. For all of you, we've talked a lot about all the challenges, and is there any thing you're looking forward to this year in terms of, serving families and helping families? I know, Michelle, last time we talked in October, and DC Safe was working on a new housing space for folks. How's that going?
Yeah, we're really excited. Our new shelter will be built at the end of the summer. So in the new fiscal year, we'll move into that building. We'll offer 30 units in that building, expanded services, expanded staff. Everything's shiny and new, so that makes people feel emotionally better. So we're really excited about that. We've been talking about that project probably the entire time I've worked here, so about the last 7 years, and we broke ground in May of last year, and they said they'd have us up and going, so that we're going to have our topping off ceremony at the end of April, where they'll put the last sort of beam, wood, plywood, something construction, on the top of the building to sort of mark that part of the process is over. And then we'll move into putting in the interior walls and things like that. So we anticipate that all will be well by the end of August, and we'll be moving in shortly after that. So
that's really exciting.
Yeah, and we also received some funding. The pandemic took a lot away, but it also opened some doors to show us that under crisis, under stress, we can make things happen. And the city is willing to expand in ways that maybe they had been reticent about earlier. And the pandemic required us to innovate. And so we were able to secure some funding for a housing coordinator. DC Safe is not traditionally a housing agency. We're going to remain in our lane, but we realized long ago that domestic violence and housing go hand in hand. Often people don't leave their housing because even though the domestic violence is escalating, they're like, where am I going to go? Or maybe the respondent, the abuser, pays the rent, or they're both on the lease and they can't get that other person out, right? So we secured some funding to really talk about and walk our survivors through housing options. We've really been building partnership and collaboration with other partners in the agency, just like Housing Up and Virginia Williams and Calvary Women's Services and House of Ruth and let me stop, because if I forget somebody's gonna be mad, right? But we have really worked to connect with those partners, and so that folks can move from our crisis space, because that's what DC Safe specializes in and does well, and move them on to next step housing that's more stable, long-term, and they can really build up some resources while they're there. A special shout out to Dash, who took one of our really, really complicated cases. One of the things that the pandemic also required of us is that we keep clients longer. So DC Safe normally goes between 1 day to 14 days, and we're averaging 37-day stays. And that also means that we're absorbing that cost, right? So maybe there's an offset for some of those days, but the rest of the days, DC Safe is paying for that and feeding families, putting folks in transportation, all that good stuff. We never release anyone unless they have a safety plan. So as tomorrow's your last day with us. If you don't have a safe place to go, we don't release you unless you want to go. We make sure you have somewhere safe to go. So we're excited about both the new shelter and our new housing opportunity to really give folks the hope that they can leave a violent situation and they won't be homeless, or they won't be struggling from going from program to program to program. That we really worked hard to help them find some stability in this, what can be a very painful and chaotic time.
Absolutely. So, yeah, stability, the key word. We talk about it, of course, all the time at Housing Up too. Liz, what about you? Anything on the horizon for Suited for Change this year?
Nothing like what Michelle said, but I'm excited about something that Michelle said as well, and that's collaboration. I only have 2 employees, but we have 50 to 100 active volunteers who have been anxious to do something and help in some way. And so we spent the first 3 months reaching out to our referral partners and having in-depth conversations with people who've traditionally always send people to us to get clothing, and talk to them about, is there something else that we can do? And that's how all the workshops got started. Can we hook the women up? If you have women living there, and Michelle, I'm going to offer you this, although if you have a shorter amount of time, but maybe not. If you have a woman that needs an employment coach, we do one-on-one coaching, and I have all these fabulous volunteers that are willing and ready and able to do one-on-one coaching with women who are stuck at home right now, and maybe could just, work on their resume or think about where they could start their job search. And so I've been excited. We've probably contacted at least 50 referral partners, and a lot of collaborations have started. We all know that we're not going to get out of this by ourselves. Each one of our organizations needs each other, and the more that we can collaborate and help each other and pick up the slack and talk to each other, that's the only way we're going to help women and families move to the next level. So I am excited about that. I'm excited that, like I said previously, that people are getting back into programs that are helping them think long-term. So, I'm excited we're still here. We had a woman just yesterday, who started crying, and she said, "Thank you so much for not closing your doors." And that's really what this has been about, is make it through. Don't close your doors. Do anything you can do to make sure that you're here. Because I'm certain, we're going to come out of this, and then everyone's going to need to go back to work, and then we'll be super relevant. So in the meantime, we're just trying to work and aid our referral partners, those that are more on the front line right now. How can we help you? What can we do? How can my volunteers come to your house, Michelle, and teach nutrition classes? You know, what can we do? What do you need? And that's what we've been doing. And we do that, Michelle. We teach all kinds of classes on all kinds of things. And I have these fabulous volunteers. And so we've just been trying to figure out how can we help, you know? So I'm excited that we're still here and I'm finding places for my volunteers to work.
Wonderful. We'll have to talk after this.
Please do.
Some thoughts for you, Liz. What about you, Sonia? As we look, for housing up, I know we are always adding new families. We have a bunch of new projects kind of coming online this year. So anything you're looking forward to?
Yeah, so we have an expansion of one of our contracts we have with DHS. And so we're getting some more clients through that route. We also have a couple of site-based programs coming online, but that's specifically for assisted living programs. And so that's going to be really interesting. So it's a new arm of the organization that we've never had before. The other thing I'm excited about is even the fact that we had emergency housing vouchers available to us at one point was great. It was not nearly enough. They ran out very quickly. But one of the things that we really, the DMV is so small that we run into a lot of families who need a voucher that they can port outside of the district or outside of the area. And the issue that we have right now is that the majority of the vouchers that are available are local vouchers. So that means they can only stay within the district. And so we will have families will put in the application, they'll get their voucher and they'll say, oh, I want to move to outside of the district, outside of Maryland or outside the district. And we'll have to tell them this voucher is only good for this area. And they are really confused because there's a lot of confusion around housing processes and they thought they were getting a federal voucher and it's a local voucher. And so if we can get more of those emergency housing vouchers available for those people that really need to live outside of the area because of fear, not DV issues, but also gang violence, just areas that they will not be safe to live in with their families. So I think that was something that was really positive that came out of the pandemic that I hope gets more federal investment.
Yeah, absolutely. Debbie, you're last up. Anything you're looking forward to this year over at NNEDV?
It's been such a crunch time and getting VAWA passed. So I'm looking forward to VAWA being passed and working on the implementations around some of the new housing protections and specifically for my work, just really letting people in the field know and programs in the field know what is available and out there. And then a big part of the push of my work too is just there's some HUD housing and homelessness funding as well, continuum of care funding, and there's a specific DV sexual assault set aside. They're called the bonus funds. And so that's been about anywhere from $50 to $100 million a year nationally. And we've seen some states who've gotten funding and then applied for new projects. So I'm hearing from a number of states, the funding notice went out the last couple of days. Like one state, Kentucky's they have $4 million in housing dollars, where just a few years ago they didn't, to help survivors experiencing homelessness. And there's Louisiana got a number of projects going. So there's a real increase in housing related work for domestic and sexual violence programs and culturally specific programs. So I'm just looking forward to that work. And it's great while it's still never enough, I think you mentioned with the vouchers, it's still really great to hear from people and hear from survivors that, even a few years back, there wasn't these housing resources and investments. And then we are doing more work. I'm part of the DV Housing Technical Assistance Consortium, which is a number of organizations. And we're really trying to look at the intersection of affordable housing in terms of creating a longer term continuum for survivors. Vouchers are great, but we really want, if we're encouraging survivors to make different choices or to consider leaving an abusive situation, if there's not an ability for their harm doer to stop harming or get help, that we really have a way that folks can come to a program or a shelter and they have affordable housing options, and that leaving, they aren't faced with the choice of not having housing or not having resources if they become a single parent or single income. So really trying to build a roadmap for our providers on affordable housing and to try to build and be a part of that or make those connections in their communities so they have affordable housing options for survivors when they leave their program. So yeah, so more housing is what I would like and looking forward to. And
Same.
yeah, so yeah, I'm really grateful for all the work you actually do at Housing Up too, that it's phenomenal. So yeah, more housing for all and
Housing for
affordable
all.
housing.
Yes,
Yeah,
absolutely.
I was wanting to add that we were also lucky to get some of those emergency housing vouchers this year. And as an agency who doesn't normally deal in the business of vouchers, it was very interesting to see how that process went. And we learned a lot of lessons there. And if clients are not and survivors are not supported through their mental health, housing almost doesn't matter, right? We were really lucky to get 14 of those emergency housing vouchers. And we've had them, most of them since last November. And it has been the level of work to get somebody through the process when their mental health is not stabilized is Herculean. It is every day. It's phone calls. It's showing up where they're camping out. It's so much work to get those vouchers executed. And like you said, Sonia, folks don't understand the process. So they feel like, well, you said I have a voucher, and they walk into a leasing office and say, here's my letter. And they're like, yeah, that's not how that works. And then they're frustrated and they disengage from the process. So lots of support around those. So it's not just the voucher, it's the support that comes with that voucher to get them through the process and help them stay in that housing situation.
Yeah, I think that's a really good point. I mean, like we talked before, even just emergency rental assistance, emergency vouchers, there's a process to having those things happen, right? It's not just, oh, money's here, vouchers here you go, here's your house. It doesn't work that way. And, it takes a lot of staff time and it takes a lot of time from the client themselves when maybe they don't have that time to give. So I think that's a really important thing to note. We'll wind it down with one last question, and then we have a couple questions from the audience. But what can the folks doing who are listening tonight, or just kind of in community broadly, what can they do to help our communities, to help the work that all of you are doing so well?
I think for DC Safe, especially our partners who might be new to us through the pandemic, maybe we hadn't worked together prior to during this pandemic, that we come to the table with a collaborative spirit. In DV, there's a lot of shame around that, and folks hide that information. So you might have a client in your office who's sort of like revealing to you for the first time there's DV, but then you call us and we know that we've helped this client, 15, 16 times. So we ask you to call with a spirit of collaboration. So if you get a no response or we ask for more information, know that we know more than they might be sharing with you immediately. And so that it's going to take both agencies, both workers to sort of get the client on task and get them the services they need. So we ask when you're calling, when the heat is up and everybody's anxious and where are we going to put them tonight, just come in the spirit of collaboration. And I promise you, we will work it out.
Anybody else? All right. So we have a couple questions from the audience. So we have, is rental assistance still available for families on the brink of experiencing homelessness? And if not, are there opportunities to advocate for more on the federal or local level?
There is still the $25 billion of rental assistance that is still available. We've heard a lot of challenges in various states and communities and jurisdictions. Some places have contracted out, or there's not a lot of oversight, and some states have really rolled out the money and are doing an amazing job. So it's like a lot of things in our country. It depends on the state and the jurisdiction. It's kind of a patchwork. I was thinking, my dog just heard another dog.
Inevitable.
But there's I have my own experience of helping people through that system in another state, and it took about 6 months, and there wasn't a real clear person that was in charge. So it was interesting to go through that process with a friend, where I was like, oh, this is really difficult. And then it took a lot of housing advocacy. I spent, I don't even know how many hours. So depending where you are, the rental assistance, it does take a lot of housing advocacy and a lot of tenacity. And it's not as easy as one would think or hope, but I've heard in other places it's a bit easier, but it's still there. In a lot of states, there's a tracker. The National Low-Income Housing Coalition has a tracker that shows you by what state and how much has it been expended. So like, for example, I had a meeting with some folks in Alabama who were like, we're not getting the rental assistance, and it had been way underspent. So then we just talked to them about, trying to figure out who is overseeing it, and maybe trying to get a meeting with the people who are doing that rental assistance money, and trying to make sure people get access to it. And then we have one state that's the Domestic Violence Coalition is actually overseeing it. I think it's in one of the Plains states, which I was surprised. I was like, oh, you just decided to take on the whole rental assistance, and they've done a great job of rolling that out. So it really varies from place to place.
Yeah, that's definitely what my understanding was as well. Oh, Sonia, were you going to say something?
Yeah, no, I was just going to add, so for the district, that money is dispersed through our ERAP program, so through Emergency Rental Assistance Program. The funding that was available during the pandemic through DC State, that ran out in October, or they stopped actually accepting applications for that. But currently they are accepting applications through the Emergency Rental Assistance Program. And they've actually created like a website now that you can go to and put in an application. And so it's actually, I think, one of the things that has improved during the pandemic is access to those funds. Because there used to be a time when they gave you a list of providers, you had to call during a certain time, during a certain day, and clients would have to like wait on the phone, and they're on hold for like hours. And so I will say that access to emergency rental assistance has improved during the pandemic. And I'm hoping that that money doesn't run out as quickly as it has in the past. And then that process is as smooth as it was during the pandemic.
Yeah. One other question, is there capacity within the DV space to align, I think Debbie mentioned this a little bit earlier, align their kind of policies with affordable housing, like align those two kind of, we're overlapped in a lot of ways, but DV is still in affordable housing tend to be a little bit separate. So are there plans to kind of more closely align those two spaces?
Right. We have definitely, again, those two pieces go together. And so we've been working to build those collaborations, to train our partners who we are, so that folks will come to us, not just in the crisis of the event, but also maybe historical information about the clients that we can assist, and also stabilize, right? So it doesn't, sometimes a DV event doesn't require that the person is, has to vacate their home, right? The respondent is vacated, the locks are changed, security is put on the property, security bars or cameras. So there are other ways to make the home safe, so that the client doesn't have to give up the familiarity and the safety of their home. So we really want to keep talking to our partners, new partners, reminding old partners, and so that we can be having this unified conversation about the housing and some of the barriers and the hurdles that our joint clients are experiencing, especially around the homelessness and the mental health piece. Yeah.
I'm trying to time it when my dog's not barking, but we'll just see how it goes. This is virtual life. There is a lot of work happening around trying to encourage people to do affordable housing development. There's some leaders in the DV field that have built housing, and really we try to elevate their work, and it is going to be something that we're thinking about in the future. And then we have been doing a lot of work and training around housing authorities, because we see if there's domestic violence occurring, or if there are mental health, or just some of the requirements around the housing authority, and or if someone isn't responsive in a way, it might be related to the abuse. So we're trying to train housing authorities on like what the VAWA rights are and to try to keep people housed, because once you lose a voucher, then you're kind of losing access to the only channel of affordable housing in our country.
Absolutely. I think that was our last question from the attendees. Is there any other final thoughts before we say goodnight? Well, thank you so much to panelists for another great conversation. I'm sure there will be more to talk about in March 2023. So we'll see you all back then in a year. But thank you so much, of course, also to the attendees. Thank you, Debbie, for dropping all those great links in the chat. And so we'll send around an email with this recording and also some of the resources that was provided tonight. So we hope you all share that with your communities so we can keep supporting families through what is definitely still not a return to normalcy. So with that, thank you, everyone. Have a good night and stay safe.